joining us for another important update about coronavirus. Here at Atrium Health, we are committed to providing the most accurate, up-to-date information from a variety of our experts. And joining us now, we have Dr. Jaspal Singh, who serves as the Director of Pulmonary Oncology and the Director of Critical Care Education at Atrium Health. Dr. Singh, can you talk us through how you and your team are preparing for coronavirus?
Yeah, we're doing a lot of work behind the scenes. I have to say that's one thing I'm very proud of working at Atrium Health is that we have teams in every facet of care delivery working around the clock to make sure that we are prepared as much as possible for the viral infection that we are anticipating, and all phases of it too, from the beginning through the end of a patient's illness. We are trying extremely hard to make sure that we and our communities are prepared. We have teams in the emergency room, the pre-emergency room areas, the critical care transport, the intensive care units, the hospitals, the clinics. We are working extremely hard to make sure that we are prepared to provide a full array of services to make sure we can help prevent this infection from spreading to all the way through making sure that our patients get the best care when they need it.
Dr. Singh, why are patients with chronic lung disease at greater risk for coronavirus?
This virus invades the respiratory tract. And when it does so, it affects the respiratory airway cells, the lung cells, and such in such a way that people who have pre-existing conditions, whether it be COPD or asthma or other chronic lung diseases, they have less reserve. They have less ability to fight the infection, and it actually gets them at the point where it diminishes their reserve. And so from that perspective, we've seen that those patients are most susceptible to the effects of the virus. And we are working very hard to make sure those patients are best equipped.
So do you have any special tips or advice specifically for those patients, for the people who have chronic lung disease or lung cancer? Anything that they should be paying attention to and doing to minimize their risk?
We're asking our patients to do a few things in this regard. Number one, know that we're there for them. We are working extremely hard to make sure we have virtual visits. Number two, avoid crowds. The infection prevention piece is extremely important. Avoid large social gatherings, make sure there's good hand hygiene. If there are sick contacts, try to avoid them as well. We don't want direct contact with them. Maintain social distance. The CDC and other organizations are recommending being at least 6 feet away from personal contacts, especially, and keep those in mind. Those are meant to minimize the spread of infection. The third thing is stick with your medicines, stick with your medical treatment plans as such. And so you don't want to start and stop medications that were there for chronic diseases. So maintain your health, maintain your physical and emotional and spiritual health so that when the infection comes, or if it does come, you're best prepared to fight it off.
Dr. Singh, we were discussing earlier that there seems to be a lot of confusion about social distancing versus social isolation. Can you explain the difference and offer your best advice on how to properly follow these guidelines that have been implemented?
Many of our patients with chronic lung disease already have issues with social isolation. They already are having trouble with breathlessness, getting out, being part of the regular community. Many are ashamed to wear oxygen, for example. And so when you mix all those factors, and now you have, the social pressures of avoiding people who might be potentially infected, or if you're coughing in public, how people might perceive you, it creates a perfect storm for people to feel that they are becoming in a deeper hole of social isolation, which is not what we're trying to tell them to do. We want to keep social distance so that they don't cross-contaminate the aerosolized virus particles. But what we don't want is them to kind of crawl in a hole and become socially isolated. And I think that's a risk we have to be very mindful of. So if people are confused about that, if people are feeling like, not sure what to do, they're feeling lost in this whole journey, just call us. We're happy to help you walk you through that. The CDC and other organizations have plenty of other information, and Atrium Health has a ton of information regarding this. But it's one of those things where we're trying to make sure that we're mindful of things. So if you're not a patient, you're a family member or know someone with chronic lung diseases, just reach out to them, call them, do a Skype call or a Facebook call or something of that nature, that like a FaceTime call. something that actually shows that you care, that you're there for them. Check in on your neighbor. Just make sure that they're doing okay.
It's important to remember the human element in all of this. Dr. Singh, great tips and information there. I do want to touch quickly on infection prevention. I know that's something that is critically important to you and the patient population that you and your team treat. Can you share any information you have about that topic, how you're reducing that risk, or any information that people need to know about?
Many of you probably know already that Atrium Health, along with Novant Health, Wake Forest, and other hospital systems and other facilities, are minimizing patient visits that are felt to be elective. And so we're trying to minimize the number of touch points that we have, and we're expanding to fill that void virtual and phone visits. So you're going to see a substantial change in how we approach our patients day to day to minimize contact with potentially huge impact in our community to minimize risk of infection transmission. But that's our system. From the individual, actually, we really want to make sure that people are following strict hand hygiene protocols, they're not aggregating in large groups, that people who are healthy actually are following the national guidelines to minimize crowding, not go to things like bar hopping or other large social gatherings. We really want people to be really concerned about their fellow citizens and minimize their risk of contamination.
Dr. Singh, unfortunately, there are so many myths and misinformation about coronavirus circulating around the internet and in peer-to-peer conversations. Is there anything you're hearing that you really want to clear up and set the record straight?
In today's social media world, there's a lot of things that are coming at us pretty quickly too. And understanding the source of truth here, what is actually scientific fact versus what is expert opinion versus what is just simply not very helpful, can be very taxing on the public. So at Atrium Health and other organizations like the CDC, for example, we've done a good job of putting all the references together and trying to demystify some of the myths out there. So what your neighbor or somebody else is saying may or may not necessarily be true. And so we ask you to sort of rely on us, and we should be able to answer all the myths on our website through our resources, because it's very confusing. But if you don't have time to go to our resources, really question what you're hearing and go to the sources of truth, because it's really challenging and it's really